Thoracic outlet syndrome, OS. Thoracic outlet syndromes refers to a group of disorders caused by compression of the neurovascular structures as they pass through the thoracic outlet, a space bordered by bones, muscles, and other tissues at the base of the neck and the upper thorax. Anatomical considerations of the thoracic outlet. The thoracic outlet is a region where important neurovascular structures transition between the neck and the upper limb. It is divided into three main spaces. One interscalene triangle, boundaries, anterior scalene muscle, posterior, middle scalene muscle, inferior, first rib. Contents, brachial plexus, roots and trunks, subclavian artery. Clinical significance. Narrowing in this space can compress the brachial plexus or subclavian artery, leading to symptoms of TOS. 2. Costoclavicular space, boundaries, anterior clavicle, posterior, first rib, medial, costoclavicular ligament. Contents, subclavian artery and vein, brachial plexus. Clinical significance. Compression in this space is common during postural deviations, especially when the shoulders are depressed or retracted. 3. Subpectoral, subcoracoid space. Boundaries, anterior, pectoralis minor muscle, posterior, ribs, second to fourth. Contents, brachial plexus, axillary artery and vein. Tightness or hypertrophy of the pectoralis minor can compress the neurovascular bundle, leading to TOS symptoms. Types of thoracic outlet syndrome. 1. Neurogenic TOS, 95% of cases. Compression of the brachial plexus, causing numbness, tingling, and weakness in the arm or hand. Pain in the neck, shoulder, or arm. 2. Venous TOS, compression of the subclavian vein, leading to swelling, cyanosis, and pain in the arm. Distended veins in the neck or shoulder. 3. Arterial TOS, compression of the subclavian artery, causing coldness, pallor, or weakness in the arm. Possible formation of emboli, leading to ischemia in distal areas. Causes and risk factors. Anatomical anomalies, cervical ribs, elongated transverse processes or fibrous bands. Postural issues, forward head posture or rounded shoulders. Trauma, clavicular fractures or repetitive stress injuries. Muscular hypertrophy or tightness, particularly of the scalene or pectoralis minor muscles. Diagnostic approach, clinical examination. Adson's test, Roux test, or Wright's hyperabduction test. Imaging studies, X-rays to detect cervical ribs or bony anomalies. MRI or CT scans to evaluate soft tissue structures. Doppler studies to assess vascular compromise. Electrodiagnostic studies, nerve conduction studies for brachial plexus involvement. Treatment options. 1. Conservative management, physical therapy, strengthening and stretching exercises, postural correction and ergonomic adjustments, analgesics or anti-inflammatory medications. 2. Interventional procedures, botulinum toxin injections for muscle relaxation, vascular interventions for venous or arterial compression. 3. Surgical management, first rib resection or scalenectomy, removal of fibrous bands or cervical ribs. Understanding the intricate anatomy of the thoracic outlet is crucial for accurately diagnosing and managing this condition effectively.